Guys, this is Preeti and you're watching Matrix Solution. In this video, I'll be teaching about the soft tissue tumors. Soft tissue tumors, I'll be teaching about lipoma, schwanoma and haemangioma. Schwanoma is also known as lemoma. There are two types of tumors, that is benign tumors and malignant tumors. Benign tumors are confined and localized to a particular area, whereas malignant tumors spread through the blood and then shows the metastatic property and damages to so many parts and causes tumors in other places also. Lipoma. Lipoma is the most common benign tumor. Among these benign tumors, lipoma is most common. It occurs in a subcutaneous tissue, maybe skin or in a subcutaneous tissue. You can see in this image, this is a lipoma. This is the image of lipoma. You can see like this. This is the image of lipoma. By seeing this image, you can remember that is a globular structure, a round structure. This is a mobile structure. These lipomas are most common in the females, the women with the age of 40 to 50 years. That is in the 4th decade or 5th decade. These lipomas are common, and this commonly occurs in the neck, back of neck or in the back region. These are prominent. Like we can see in most of the people in the back region. These grossly you can see that this is a small and these two lipomas, these two tumors as lipoma and schwanoma are encapsulated, whereas haemangioma is not encapsulated. So the gross feature is small and encapsulated. You can see round or globular. This is mobile. Cut section appears as this like this, yellow and greasy. This is a lipoma. Cut section appears as yellow or greasy to touch, and other point will be the slippy sign will be positive because we cannot hold that lipoma, that will be mobile, so slippy sign is positive. And as it is occurs in adipocytes, adipose tissues, it contains fat will be deposited in there and then stored. It doesn't take any stain, so we have to use other special stain called ORO, that is oil red O stain or Sudan black stain. And microscopic features, you can see this is a this represent the microscopic features. These are adipocytes. This is a thin capsule. The adipocytes having eccentrically placed nucleus, and this where fat deposition takes place, there it doesn't take any stain, so we have to use a special stain. Here it has vascular tissue, that is vessel, blood vessels. Blood vessels may be congested or dilated, and it contains fibrous connective tissue. So this septum is called as a fibrovascular septum. And you can see mature adipocytes in the lobules. It forms lobules. Inside the lobules there will be adipocytes. Adipose proliferating. Mature adipocytes has been labeled. This is about a lipoma. And schwanoma. Schwanoma is also known as lemoma. It arises from the cranial or spinal nerve root. You can see this is a schwanoma, gross feature of schwanoma. As the name suggests, lemoma, it appears in the nerve sheet. The nerve bundles, that is vesicles, will be there. Here nerve sheet. This is a cyst. Sometimes cyst may also be present. This is a gross appearance of schwanoma. Schwanoma is also known as lemoma. It is also encapsulated, as I already told. Cranial or spinal nerve root, it appears. And it may be single or multiple. Multiple only example will be von Hecklingshausen's disease. This is the only example for multiple schwanoma. And the gross feature will be encapsulated, as already told. Nerve fiber is a solid, so solid. Sometimes cyst or tumor may be, this is a cyst. Sometimes cyst or tumor may be also seen. Because of that it appears enlargement of the nerve fiber. A microscopic feature, you can see oral fibrocellular structures will be there. These are oral fibrocellular structures. Here in this region you can see dark stain. Here cells are more. So hypercellular area. This hypercellular area is known as Antony A. This hypercellular area is known as Antony A, and hypocellular area, this where the cells are few, this is known as Antony B. And Antony A contains a nuclei in the form of elongated nuclei and placed like a stack of coins. This arrangement is known as palisaded nucleus. Palisaded nucleus is also known as varicobodies. This Antony A contains palisaded nucleus and varicobodies. This Antony B contains less cells. This is known as hypocellular area, that is Antony B, and congested or dilated blood vessels. You can see, and the connective tissue between those you can see. So macroscopic features will be fibrocellular bundles that are in old fashion, hypocellular area and hypercellular area. Hypercellular area is also known as Antony A. It contains palisaded nuclei, that is also known as varicobodies, and hypocellular areas are Antony B. Degenerating areas are macrophages and hemicydrin will be there. And other tumor we will discuss about haemangioma. There are two types of haemangioma: capillary haemangioma and cavernous haemangioma. hemangioma. Capillary hemangioma, example for this capillary, one of the type of capillary hemangioma is this is strawberry hemangioma. Strawberry hemangioma, you can see this this occurs in a childhood. Hemangioma you can see in a childhood or infancy. This is one of the type of the capillary hemangioma. This is a strawberry hemangioma. In strawberry, this capillary hemangioma, here only you can see this occurs in the site, skin or subcutaneous tissue. It occurs in infants or childhoods. This way, the diameter may be capillary hemangioma a few millimeters to centimeter, maybe till centimeter, and it may be flat, that is attached to the skin, or elevated slightly above from the skin, and this is soft and spongy to touch. You can see by you can recall all these points in this image only. These are gross features of capillary hemangioma: small or large, flat or elevated slightly away, red or purple due to the if the occlusion of artery occurs, the oxygenated blood, so red color appearance, purple because of carbon dioxide, that is venous occlusion, purple appearance, and few millimeter to centimeter it appears. Microscopic features you can see in the capillary hemangioma. Capillary hemangioma, I told already, it occurs in the skin or subcutaneous tissue. This is the skin, this is a dermis of the skin, and this is a epidermis. Epi means above this is a dermis. Epidermis has 5 layers. Initially this is formed by the epithelium called stratified squamous epithelium. Stratified squamous epithelium. Stratified means many layers. It has many layers. Squamous epithelium we usually consider the above layer, so it is a squamous. So stratified squamous epithelium. Basal layer will be columnar epithelium, then polygonal epithelium, above so squamous epithelium. This is a keratin as it is a skin, and you can write capillaries. Capillaries, you know, the arteries and blood vessels are lined by the endothelium cells, but in capillary hemangioma they contain pulp endothelium, and they are filled with a blood we usually represent as RBCs, and this is a stroma containing connective tissue. This is about the capillary hemangioma. And cavernous hemangioma. Cavernous hemangioma may be single or multiple. If that is a multiple, it can be fused, or they can be present in a discrete form. This is also soft to like a spongy and soft to touch. It occurs in a visceral organs like liver, spleen and all. Gross features will be 1 to 2 centimeter, red and blue as a capillary hemangioma, and soft and spongy to touch. Microscopic features you can see here. These are cavernous spaces. Cavernous spaces, large dilated spaces, and these are lined by the stratified squamous epithelium, and this is a lymph. There will be muscle bundles or in the skeletal muscles. This is in a skeletal muscle, so you can see, and these are also filled with the blood, partially or completely filled with the blood. Other diagram which shows the capillary hemangioma, this cavernous hemangioma is this. These are large and dilated flattened endothelium cells. This is in the liver. I already told this cavernous hemangioma will be seen in liver or in visceral organs, that is liver, spleen or anything. These are cavernous hemangioma. Cavernous spaces are lined by flattened endothelial cells filled with a partially or completely filled with a blood. These are normal hepatocytes. The remaining will be stroma or connective tissue. This is all about the soft tissue tumors. We discussed about the 3 soft tissue tumors: lipoma, schwanoma and hemangioma. Hemangioma again for the 2 types: capillary hemangioma and cavernous hemangioma. If you like my videos, please do like and share, subscribe to my videos. Thank you.